Good morning, everybody. It is Friday, February 5th, 2016, and it's 7:37 in the morning here in Franklin, Tennessee. I'm here at Dan Miller's place for day 2 of Coaching with Excellence. All right, so just in case some of you are checking out my story today and you are not aware of what's been happening, I want to recap real quickly. A couple of days ago, I started noticing a little bit of a pain in my gums underneath one of my molars back here. I felt something come out when I had flossed and thought maybe something had just punctured the gum and that it just needed a little time to heal. I started getting a little concerned when the pain wasn't going away, and the reason why I was concerned is that I am supposed to leave for a trip to New Zealand this Monday. I'm giving a keynote address at a conference there, and then I'll be there for 2 weeks. And well, I'm here in Franklin, Tennessee for the Coaching with Excellence workshop with Dan Miller. It's now Friday. Last night I decided the pain was enough that I probably need to see a dentist. In my mind, there's no way I would have an opportunity to get everything taken care of Monday morning at home before I leave for the airport for my flight to New Zealand. So I had this crazy idea. I wonder if it's possible for me to see a dentist here in the Franklin, Tennessee area. I wanted to see if a dentist would see me last minute. I'm out of town. I'm not a patient. I'm even out of state. I basically went to Facebook and shared with all my Facebook friends exactly the details of what I just shared with you. Within about 10 minutes, I ended up having about 7 different referrals to dentists who would probably see me today. Also within that time frame, I got a text message from Andy Traub who said he was just texting his dentist and he would let me know if he texted back. Andy texted me back and said that his dentist did respond to his text and they had a phone call. Long story, not as short as it could be, I guess, but I have an appointment to see a dentist this afternoon. I had the opportunity to share this story with the folks who were here for Coaching with Excellence. Dan wanted me to tell the story about the power of network and relationships. But the story even got more incredible, as if that's possible. The folks who live in this area said that it would be practically impossible for the average person to accomplish an appointment on Friday here. I didn't know this, but it turns out that dentists in this area, they're not open on Fridays. That's right, my friends. The dentist that Andy Traub connected me to, he's coming in on his day off. The dentist that I'm going to be seeing is Dr. Phillip Kemp, and you can see right there, office hours open Monday through Wednesday and Thursday. It is now 12:20 p.m. and I am here at Kemp Dental for my dentist appointment. Good news, guys. It's just a small chipped tooth and quick filling and I'm out of here. Go ahead.
Oh, he snapped you.
Is it a video?
Video, look right here. See, this is how you do it. No pain. It doesn't feel a thing. Watch. Oh, feel that? Nothing. See?
Guys, if you're ever in Brentwood and need dental work, Dr. Phillip Kemp. You guys aren't going to believe this. He didn't charge me a penny. What? I am so incredibly blown away all the time by all the blessings that have been bestowed upon me. And now, I'm on my way to go get something to eat. I haven't eaten today at all. Nothing at all. Alright guys, so I'm sitting outside of Chipotle right now, but before I go in, I wanted to share a couple thoughts. The first thought is, I want to tell you that I was tempted to not take care of myself and my tooth. Oh, by the way, if I sound funny, it's because half of my tongue is numb and the whole right side of my mouth. Anyway, back to the whole tempted to not take care of myself and my tooth. You see, that's what got me to the place where I was physically. For those of you who might be new to following me, just 14 months ago, I weighed 268 pounds. I got that way because I always put my business priorities above taking care of myself physically, my health, my fitness. And I was tempted to slip into that same mentality with this trip. I came down to Nashville to attend Coaching with Excellence, to take my coaching side of my business to the next level. I attended every single second of every session yesterday at Dan's place. I allowed myself to ignore what I was feeling with my tooth and just to put it off so that I could stay focused on what I need to learn for my business. But last night, it occurred to me I need to do something about this. I can't put it off. Putting it off is something that the old Cliff would have done. But I'm not him anymore. And, well, I missed every session this morning for Coaching with Excellence. It's 3 o'clock in the afternoon right now, and I'm still not back to Dan's yet. But you know what? I did what was most important. I took care of me. I want to say thank you to my friend Stuart Crane, who reminded me that he once had a toothache before he went on a business trip. I won't go into any details, but he reminded me that I really needed to get this taken care of. So, thank you, Stuart. And that brings me to the second thing I wanted to share. There's a lot of value in sharing what you're experiencing in life with others, what you're learning, and just what you're experiencing. I told you guys just 2 days ago that I had a confession to make, that there was something that I wasn't telling you. And then I told you how I had been experiencing this pain and that I probably should do something. But in my mind, I really didn't have a plan on doing anything specific before I left for New Zealand. In a way, I almost thought that I was just going to try to keep my teeth clean, floss, brush, mouthwash, really clean for 2 weeks. And if it was still hurting when I got back, I would go see a dentist when I got back from New Zealand. I think subconsciously I knew that was a ridiculous idea. And I believe subconsciously I told you guys about it because I knew that there would be some sort of accountability that goes with that, to do the right thing. I mean, I know that I'm not responsible for what other people do, but in a way, by sharing my life online, I feel some responsibility to lead by example, to live a life well lived. It doesn't mean that I won't make mistakes or do stupid things, but it does mean that when I do, or when I'm almost ready to do something stupid, that I own it and I'm authentic about it. Anyway, I don't have a conclusion to these thoughts. I'm actually really hungry, so I'm going to go in and eat my Chipotle now. Dr. Kemp said that I should have no problem at all eating, just make sure I don't chew my tongue off. Oh, and I do have one more thing, another update. Since I knew I was taking the morning off to call Dr. Kemp to get the scheduled appointment to get in there today, I went ahead and called Anthem Insurance because that was on my to-do list as well. And this update will only make sense to those of you who are watching my Snapchat story from a couple days ago, or for those of you who have watched episode 642 of the Cliff Ravenscraft Show podcast. You can find that at cliffravenscraft.com/642 if you want the backstory on this one. I called Anthem today to have them backdate the enrollment, and they said they couldn't do it. They got a specialist on the phone, and the specialist got a 3-way call between Anthem and Connect with Kentucky. The Connect person said that they could not do a backdate, and therefore I'm left without insurance until March 1st. They both understand that I have documentation that basically gives me every expectation that I should have coverage from January 1st. And the Connect, the Kentucky marketplace, said that they could do an appeal process, but that would take 2 to 3 months to process. The person at Anthem told me that they could do an appeal process, but that would take 30 days to process. We all three agreed and talked it out that the best thing to do at this point is just to stick with the March 1st effective date. My daughter Megan did go to the clinic back in January. I think that's probably around $100. My daughter McKenna went to the doctor just a week ago, and that was because she had a sore throat and we wanted to rule out strep throat. That will probably end up costing a couple $100. However, the payment that I made in January, $1,297, that's being refunded to us, and it should be here in 7 days. And because there's no coverage in February, there's no payment due this month at all. So we plan on taking the refund and paying the medical bills out of pocket. And of course, as always, we're praying that nothing serious happens between now and March 1st medically and financially in that area. However, if something serious were to happen, a car accident and hundreds of thousands of dollars of medical bills, the appeal process would certainly be something to pursue at that point. And to wrap things up, I went ahead and paid for the March 1st payment, the initial payment on the new policy. The moral of the story? Sometimes these things sit on your to-do list and you don't want to do them. You have other things that you think are a higher priority. However, every now and then you have to check yourself before you wreck yourself, as my friend Ray Edwards would say, and you have to reevaluate those priorities. And one can't overlook the fingerprints all over how things happened and fell into place so that this was all taken care of before I fly to New Zealand on Monday. And what am I talking about, those fingerprints? I'm talking about the fingerprints of God with his hands all over this. I guess there was a conclusion I needed to get to with these little thoughts. All right, now I'm going to go eat.
He turned to his friend and said, I can rewrite that guy's sign and fill that hat with money. And his friend,
Those wonderful success stories that we're always waiting to hear and eager to share. So that's what we're going to do.
You are
And in-
all now officially part of our family.
That's Alright guys, it is now 10 p.m. We just left Planet Fitness, myself and Carrie Oberbrunner. We did 45 minutes of cardio after a very long day. It is 11:25 p.m. and I'm about ready to wrap up an incredibly blessed day, to say the very least. I did get somebody who sent me a private Snapchat and asked me, I think, a very valuable question. The question was, hey Cliff, why do you think the dentist gave you all of that work for free and didn't charge you? Was it for marketing purposes? I actually know the answer to this question, and I can wholeheartedly tell you that no, it wasn't for the marketing purposes. When I went there, Dr. Kemp had no idea who I was and nothing about my online following. Here's what I can tell you. My friend Andy Traub texted him and talked to him by phone last night. I know my friend Andy enough to know that he probably made no mention of, like, dude, if you help this guy, it could help you out. Big time social. No, that's not how that conversation went down. I'm almost positive. What I can tell you is that my friend Andy Traub is a brother in Christ. He's one of those Jesus people like me. He also told Dr. Kemp that I'm a Christ follower and that I devote my life to serving and helping other people. And sure, he made mention of some mutually admired acquaintances that I happen to be connected to. And that wasn't so much for the clout of helping a friend of such highly esteemed people. Instead, it was more of in the lines of the fact that these people associate themselves with me, that this alone speaks a great deal to my integrity and the type of lifestyle I live. Personally, I think that probably had very little to do with the conversation, and honestly, the word of Andy Traub alone was probably enough to convince Dr. Kemp of who I am and why he might want to help a brother in Christ. Somebody who happens to be in a very sticky situation with getting ready to leave the country for 2 weeks on Monday and being out of town, out of state, here locally until the rest of this week is over. The call between Andy and Dr. Kemp was probably relatively short, and he agreed to see me today. Now here's the deal. His office was closed today. I already told you that. However, it's not what I thought it was. He didn't come in on his day off. Yes, his office was closed, but it wasn't his day off. I don't know how often he does it, but today was one of the days that he did what he did today. You see, Dr. Kemp donates, contributes a good bit of his time to teaching dental students from the local university. And he trains them personally, teaches them dentistry. I'm not 100% certain, but I'm about 98.5% certain that he doesn't charge anything for this training and teaching. Instead, this is something that he does as an opportunity to be a witness of the faith in Christ that he has to these students. So, what does he do to train these students? He teaches them how to do dentistry on patients, but not paying patients. You see, Dr. Kemp has connections to an organization, a Christian-ran organization who helps people who are in situations such as recovery from pretty significant drug addictions. These are people who are fully committed to genuinely living clean and staying clean. These are the type of people who aren't entitled. In fact, they're just grateful to be alive, and they're grateful overall. I met a couple of those patients today, sat in a room while each of them shared a little bit of their testimony about how they got clean. These patients were sharing their testimony to the students from the university. This, in my understanding, is Dr. Kemp's attempt at helping these students understand how they can use their profession in dentistry to serve people with purpose and to live their life of faith through the work that they do. Dr. Kemp has a huge belief in paying it forward. He's paid really well to do cosmetic dentistry, and he has a heart and passion for ministry and service to those who are not entitled but certainly couldn't afford his services. I don't want to share the full details right here, it'd take too long, but I can tell you I met two people today whose lives will drastically be changed forever as a result of getting a whole new look through their smile. You see, even if I wouldn't have come along, that's how Dr. Kemp was going to spend his day-to-day anyway. When Andy called, he's like, I'll just add him to the list. It'd be another opportunity to teach these students. I don't believe he had any clue about my online following. And when I told him that there'd be tens of thousands of people who would be following this process, he seemed pretty blown away by it. But he says, honestly, that has nothing to do with why I'm doing this. And I would do it even if you only had one Instagram follower. I honestly believed those words, bar none. I know it to be true. I believe it. The thing is, though, is I fully expected to pay for my services today. Fully. I wasn't feeling entitled either. He said, Cliff, you've already paid by allowing me to surround you with 7 students while I was digging around inside of your mouth. So, my friends, the reason why he didn't charge me is because he felt led by God to do what he did today. And he was already going to be giving freely of his services on this day today, whether I would have showed up or not. And that, my friends, is why I'm seriously considering having Dr. Kemp be my dentist from this point forward. I mean, I'm already down in Nashville at least 2 or 3 times a year anyway. Why not just come down and do my every 6-month checkup while I'm here? Obviously as a paid patient moving forward. And with that, my friends, I'm going to call it a day. And I do want to leave you guys with one final thought. And instead of telling you that thought, I'm going to go turn some lights on and leave it as the final image that you'll see in this Snapchat story.